Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, we are super excited to have you here because we're having some fascinating conversations with real leaders that are painstakingly reshaping the future of healthcare. We're really passionate about a few different areas. We're passionate about leadership, access, innovation adoption. And if it's your first time tuning in, let me just sort of take a quick step back and tell you what we're trying to do here. So we're focused on bringing real stories of innovation to life, not just the things that you hear on the highlight reels, but real things that are happening in real time. And the aim is to highlight these folks that are getting stuff done, learn from them, also learn from some of the failures and some of the setbacks, and also from the wins, and to give them the opportunity to share this with our community. If you haven't had any opportunities to check out any of the historical interviews, regardless of where you are, whether you're watching this or listening to this, please hit the subscribe button now so any of the new episodes come directly to you. So today's guest isn't just reimagining healthcare. He's really laying the foundation to make that vision operational. So what happens when like a practicing anesthesiologist walks away from the OR? Not a burnout, but because he sees a bigger way to serve. Dr. Navin Goyal is that type of a disruptor. He's the co-founder of Loud Capital, a purpose-driven venture firm that's flipping the script on traditional investing. So Loud backs people, not just ideas, and amplifies impact by aligning returns with purpose. So Navin believes capitalism can be a force for good, and he's proving it every single day. So after co-founding a number of different companies, and he's experienced firsthand the pain points of early stage innovation, he decided that he was going to shift gears, left his clinical career. He's built this platform where he's just a lot of these mission driven founders sort of are attracted to what he's doing. He's been able to raise a bunch of different capital, and he's been able to build some really amazing partnerships. So now that he's sort of helping redefine what it means to be a physician, an investor, and a builder of systems that actually work for people. In this particular conversation today, my hope is that we'll sort of explore a few different areas, what it kind of takes to build a fund that's rooted in values, how to democratize access to entrepreneurship, and why obviously more doctors ought to be more capital allocators, and also why the best healthcare solutions often start outside of the system. So Navin brings a rare mix of clinical insight, entrepreneurial courage, in my opinion, and investor clarity. So, Navin, it's great to see you. Welcome to the show.
Thank you so much, Michael. Wow, that was quite an intro, and I'm honored to even have some of those things that you said. But um, actually, what's on my mind is the preparation and the summary that you just did is doesn't go unnoticed. So that's impressive.
Oh,
Thank you.
appreciate that. Yeah, look, I'm a maximizer by design, right? So it's like you try to the people that are coming on the show, it's your show, right? So you gotta.
Yeah.
I'm not the star of the show. You're the star of the episode. So let's dig in. So you're a trained anesthesiologist.
Yes.
You were practicing, steady life, nice path. What moment, what or tension made staying in that path feel more dangerous than actually leaving?
Hmm. That's a great question. So I think the moment was when I realized the lack of structure in the entrepreneurial world, which is so scary and still is a little is scary, also allows room for creative space, passion,
Yeah.
purpose. And I thought that was refreshing. And that was after several years of working in private practice. I became medical director of a hospital, and I kind of just felt the ceiling on doing more, learning, growing. I also felt like my learning curve was pretty flat. And after studying so hard and passing boards and seeing patients, after a while, the physician kind of lane, especially at least my experience in anesthesiology, becomes a bit boring. And
Mm,
boring is safe, so that's a good thing. But the
right.
problem is it's boring. And so what I saw as excitement and opportunity in the entrepreneurial space, especially early on in healthcare, where my first venture, Offer Health, uses those anesthesia like skills to bring care teams to dental practices and take care of kids on Medicaid who have these long waits. And so I started seeing like these solutions we're able to create in a business
Yeah.
using some of these physician mindset and skills. I was like, man, I think there's a lot more to do out there. So I didn't think more of the, well, you said danger of like which one's more dangerous. And I think, yeah,
Yeah.
sitting with that potential, with that creativity, but applying it only in the comfort because I worked hard to get to this
Yeah.
place. I really had to reflect and say, well, we're always evolving and growing. So maybe this place was great, but today I'm different. Today I see different opportunities. So maybe the place is over here. And that grew
Mm,
so strong that, you and others call it courage, but um, I, I, I call it a continuation of the will to live, you know?
mm. The continuation of the will to live. Because you mentioned it, you fight like hell just to get into medicine. It's
Yes.
so competitive. And then to shift away where most would say, well, hey, that's kind of a safe bet. They're just, those are chips on the table that you're leaving. However, what you just mentioned to me is more around alignment and realigning. And that's really interesting. But we're going to go back to O for Health in just a moment, but I want to just sort of because with what you're doing at Loud Capital,
Hmm.
I remember from our first conversation very vividly, like it's not just a name.
Hmm.
It's really a declaration. Um, what was that sort of quiet moment that led to that precipice and that loud
Yeah.
conviction that you had?
So I would say as I was building off for health, so many things that we needed help with, and capital was one piece. There were so many other things that we were able to just lean on other people, mentors, and find your way. And from legal to how do you take care of a patient in a dental practice where you're coming from the medical space? Like there's
Yeah,
legalities there, there's
yeah,
different things, there's logistics. How do you order medications, right? Like all these things, and then there's the business. How do we charge customers? How do we, before we got insurance contracts? And so you just realize, like, gosh, there's so many things, and I'm not even thinking about money at the moment. I'm thinking about
yeah.
building. And from an investment standpoint, it's the same thing. We found that when we spoke to founders, like, hey, I'm raising this. I'm like, okay, and then what do you do with the money? How do you make those decisions? How do you bring and attract talent? How do you retain talent? How do you lead and be humble while you need to be a little bit of an ego to drive forward? Like all these things. And I've really realized that I really nerd out on connection and people and figuring out
Yeah.
pieces and how to place the right teams together to move forward productively. And
Is that a skill? Is that a skill, or do you think that's a gift? Like, can you teach that to somebody? Can you teach that to me?
I think there's a foundation of a gift. I think connecting with people and um, being aware of and empathizing with them is maybe a foundation of a gift. But I've worked really hard to turn that into a strength of mine.
Mm,
So I think there's a little mixture of both, and I love that question. But I think almost everything we do, we have to honor some effort put into it, right? So
totally.
that the smart, gifted people in my school that I was in high school with, and I was not one of those. They had the choice to take that into to open doors or to sit on it and not really work on it, and that became maybe a overconfident aspect, which took away from their potential. So so it's a bit of a gift, but I think it's almost like a box of opportunity, and what we do with that
Mm,
is up to us. We can open that up
hmm.
and add on to it, or we can keep it closed and it shrinks. And so, going back to Loud Capital, we named it Loud to be loud and active outside of capital, even though it was called Loud Capital. And,
Right.
and just that realization with not only ourselves, but with other founders that they need so much more. And in the interest of being connecting with people, I felt this is really a differentiator because they need just even like emotional support. I mean, such a wave of up and down. I've had
It's a real, yeah,
conversations where founders are crying, or sometimes I've been emotional. I mean, and that's what I love about it. I mean, that's why I'm here. Venture
yeah.
capital for me is like I've been using the term value creation. we need to create value. And how do we do that? We need to bring our best selves to the table to enhance the vision. And capital is one piece, but it's one piece of many pieces.
Yeah, so that's it's one spoke on the wheel. There's a lot of
Yes.
spokes that are on the wheel. And just
Yeah.
given your experience going from the OR to then founding a company, I know that journey was quite a long journey in terms of aligning on the business model, the care delivery mechanism, and all those things coming together. Is your sense that had you not gone through those tours of duty, I call them tours of duty, um, would, would that sort of make it more difficult for you to speak into the lives of many of these founders?
Absolutely. And let me say that a lot of people in the industry, the venture capital industry, have not built or have not been part of a growth company like truly where you're worried about payroll, you're worried about how are we going to figure this out. And it comes out. It comes out in the empathy. It comes out in the ability to help or the lack of ability.
Mm,
It comes out in the interest or passion or lack of passion. Because if someone comes from a financial background who's amazing with numbers, jumps into a VC firm, starts a fund or joins a fund and starts investing, I've seen the gaps on vulnerable founders who really need help or support outside of just the capital, which is everyone, and they remain investors and investors only.
mm.
Not a team member, not a person who you can call or text. It's someone you report to because you gave me money. And I see it all the time. So I absolutely believe that building a company, being part of a early stage company, getting that experience also builds experience and empathy that make you more successful, relevant, fulfilled as a investor.
Yeah, there's a different type of currency that you're talking about here. And oftentimes we talk about investors and the currency that they give, which is money. But the other currency that you're talking about here is belief.
Yes.
Belief, and sometimes, not all the time, sometimes it's just as important, if not more important, than the check in and of itself. And I've seen it go the other way, where it's very transactional. Money is given, no belief, no support given to the entrepreneur. And it is a really lonely place to be.
And
And
I've
you're,
I've seen companies die. I mean, so yeah, we're on the same. Companies die because of that, and there's a lot of companies that are dying right now because of that. And
mm,
so I feel the model of bringing capital, emotional support, um, safety, and I call them team members. So whether it's us or helping bring experience and mentors to the company, which is also another whole thing to figure out people and human capital in general. If you can bring that together, if we're just talking about business, you've mitigated a lot of risk. You've
mm,
accelerated your time to value, which everyone wants. Every stakeholder wants that. So
mm,
you're addressing what everyone wants to do and you're bringing it as a holistic aspect. And it's like, we built this relationship with the leadership team. Wouldn't it be great if we just all provided this so you don't have to like spend so much time like worrying about who's this person, what are they doing, who's this entity, this partner, okay, I'm getting capital from them. So it's really all that. By the way, I'm saying this so nonchalantly. It's taken a decade to build this
yeah,
and
yeah.
execute on what I've wanted to do. We're here now. Like we formed something called the Loud Collective, and we have executive talent, we have workshops, we have what we call accelerators, who are the steward of people who help guide and look at objective numbers to guide decisions. I mean, so proud right now. So you're just catching me at a very proud time, and I'm one person of many people. So
Mm.
if I say I'm just one person who loves to communicate and speak and do these things. But there's so many people behind this.
Was there a moment where you just saw that there was a portion or a component of the venture capital culture that you just felt I think appalled is a little bit of a strong word, but I'd say maybe allergic to. And
Absolutely,
how did you
absolutely.
sort of resist that?
So it's actually it's a skill set in life that I've learned is to not focus on on the bad, or let's call it a competitor. It's just looking inward, and building yourself up on what you want to see. And so um, I am there's a lot of like um, not great people in the venture capital space, not doing ethical things, or care about profit over people. Where I think investing in people will give you profit, and go
Yeah.
driving purpose will give you profit. Like, we're not ignoring that, but the things to figure out is people. And once you
Mm.
can spend that time, and honestly, that's what some of the diligence is spending time with people and understanding them. The data room's there, fine. The objective numbers, all that's great, but you need to do this part, which is harder to do. Um, there's a lot of people who aren't doing great things with money. They're accepting money from big capital pools, and they're not good stewards of the money, but they're also just taking such missed opportunities. They're taking that
Mm.
capital and they could be pushing many great things forward and make money, but it takes intention, it takes vision, it takes patience, and yeah, so there's just so much to be improved in our industry, but hey, we have a team and we're doing our thing, so that's what we're
Yeah, you're
focused on.
doing your so you have such a unique way of backing people at the earliest stage, and and before most firms even notice. Like, walk me through your pattern recognition. What is it that what are the
Yeah,
signals that matter most to you that others miss?
so I think, yeah, and early on we did pre-seed, so it was very early before it was like, even the first customer. We did that very early on. We learned in various ways what was working, what was not. Today we're going a touch later, and so you're a company. You've proven some that customers will want to buy your service or product. You have some revenue, but you're still early enough where you're moldable, and you have not figured out all the kinks yet just for growth capital, which is a different
Yeah.
art and different science. And so it's just capturing, and it usually could be like a seed series A, where it's early enough where we are, mutually welcomed as a team, and it makes sense, because that's really important, right? If you just look at us as a check, it probably, you're not taking advantage of all the things we have to offer, and
Yeah.
we have a
Yeah.
lot of fun outside of the capital. And so it's early enough where the other thing I'll say, because you said before other VCs discover, or it's interesting. So the popular companies that were people are fighting for, like, there's no reason we need to either compete with that, right? If the founder is like, hey, I got 10 VCs who want to give me X amount of checks at this valuation, cool. Like, we're not competing or racing, because there's so many great companies doing
Yeah.
great things. And so if you go towards the noise, man, you just miss all the gems. And being in the Midwest, I grew up in the Midwest. There's way more entrepreneurs and founders than funds. And
That's right.
so we've been able to just get build good relationships with people who are not getting that attention. Doesn't mean they're less sexy, or less ambitious, or less anything. It's just yeah, there's just only so many funds that exist.
Yeah, there's a lot of there's acres of diamonds in
Oh
areas
yeah.
that most people are not willing to go in and look at, because you speak a lot about values, which aligns with me very much. How do you operationalize those values when, let's just say, for example, if there's a company that's maybe that's had a few rough quarters,
Hmm.
and needs to survive? What does that look like in real life?
Yeah, so you go down to the again, approaching with empathy, in the sense of, not why did you miss a quarter, but like, what did contribute to this, and let's look at the reasoning. And was it
Mm.
because, hey, a couple months ago we all agreed that we would get someone or something to address this because it was overlooked, and we didn't learn from that? Then it's like, okay, how are we gonna move
Yeah,
forward without making that same mistake? Because this is costly. It's costing time, it's costing money, it might cost your business.
right.
Now, if it's a reason of, well, we missed that, or this was an unanticipated thing where your customer is just not paying you, which we know happens in many instances, then
Yeah.
okay, how do we move forward in a way where we're not reliant on this one customer that's not paying, right? So I guess that question you asked is like that happens all the time. And so it's how you react and how we work forward versus saying, yeah, the last 2 quarters the numbers look horrible, because that's what I feel like the traditional conversations are. And what that does is, and I've seen it on all sides. When I've been I've seen it and I've experienced it. It shuts down the communication line. It adds stress over here on the founder side, and you're basically saying, okay, you're not going to help because you're disappointed and you're not offering like how we can help, right? So
Yeah.
so it's like the problem solve. When I say team member, like we need to say, okay, let's look at the numbers. Okay, they're lower. Like, what can we do collectively to make these look better? That's the
Mm.
difference. That's the different approach. And it's not like rocket science, but it takes that intention to say it's okay that we miss these numbers. We're not we shouldn't be judging you by every quarter, right? We should maybe let's call it a year. Let's talk about an annual thing. Okay, look, we've been like this. And every company I've been a part of or experienced or founded or whatever has been like this.
Yeah.
Now,
Not
the
very few
headlines
go
might make
like
you
this.
think that everything's like this, right? Oh my
Very
gosh,
few.
no.
Very few.
So, or if they are, you can also do financially, creative things to make it look that
Yeah.
way. We all know that, right? So those are just a few ways that, I feel like we approach differently, and those discussions happen internally. So Loud Capital, Loud Collective, same thing, hitting numbers and doing things. We treat this situation the same internally as we will treat our customer stakeholders, founders, etc. It's
Yeah.
just being consistent.
Mm. We're in a world right now where a lot of visibility and especially on LinkedIn, there's a lot of highlight reels that are going
Mhm.
on. Um, on the contrary, I mean, and you've got a lot of great things that are going on, by the way, like a lot of momentum. Let's get real for a second. What's been like a recent personal, business step back that humbled you? Any that come to mind?
Oh gosh, I'm humbled every day. It's funny, and I want to say something really quick. Is yesterday I saw a surgeon I used to work with, and 5 years ago, and he said we haven't seen each other for a while, and he goes, Naveen, I still remember the last month you were working with us. There was an emergency patient, post surgically, they were bleeding. We were rushing to the OR, and I go to him. I'm like, man, this industry really humbles you, doesn't it? And he says he remembers that specifically because he was like, exactly, like, I feel like the surgery went so well, and here we are going back to the OR. The patient did fine. But so we get humbled everywhere. I'll say that you said I have momentum and we have momentum, and I completely agree. In that, I've been really humbled though by figuring out this model. It's taken a decade. I still see these big check writers. Again, capital is necessary, especially for this industry, to fuel all these ventures that we want to fund and mitigate
Right.
risk and accelerate value. They're still going to these top five firms. They're gobbling up money. And when you look at, if you're
Mm.
just going to be a numbers person, you look at returns, they're not great returns, especially for these smaller, nimble funds. When you look at, co-investment opportunities and all these, like, people want deal flow, it's off the same baskets, off the same things that people know about in the headlines.
Yeah.
So I'm consistently humbled by that. Now I think to build the model that we built, it came out of not getting easy money. Um, and that's, maybe let's call it a holistic setback, but that really fires me up to
Mm.
continue doing it. Um, I think there's also been a few people that I've relied on that, um, I realized like they didn't invest in themselves like I have been investing in myself. So I've changed and they've changed. So I've been humbled by some relationships that I've relied on to execute on various aspects of my business,
Hmm. Hmm.
and that didn't go as planned. So that's always tough because I am a people person. I do read people.
Yeah.
Far from perfect, but so I take those things really seriously, and I've been hard on myself sometimes, but I'm
Yeah.
getting better at understanding that we all evolve and there's different paces of evolution. There's also
Yeah.
different interests. Like my interest in venture, it's been a couple tough years. I've had deep moments with myself where I'm like, is this what I truly want to do? And guess what? I came out with such conviction. I absolutely want to do it. And just because there's a few years of like slow capital raising or adversity,
Yeah, it's been
I'm being
tough.
tested. I'm being tested.
It's been tough.
So I've, those are just a couple examples of being humbled, but I am humbled every single day. There's no
You know,
room for
You've
getting.
been you've been really vocal around having physicians be capital allocators, um, and many don't answer that call. What do you think is behind that? And talk to me more about that.
Sorry, what's the specific questions? Like,
Physicians being capital like physicians being investors, and
oh
how
yeah,
you've been, you've spoken about that before. I'm just sort of
yeah.
curious. You're elaborating a little bit more on that. Why not as many physicians have actually answered that call to be, capital allocators?
That's a great question. I think there's a guard put up by a lot of physicians. There's a lot of inbound sales that happens to physicians because they are accredited investors. People assume they have a ton of money, and so they're constantly kind of sold to. And so, what I've realized through organic conversations and the story that I have, being a physician and personally investing and personally building, I've had these great conversations, and there's so much interest from physicians to, just like anyone else, diversify their investments, um, eventually bring some income in to save them time and increase their quality time. So, there's a lot of allocation from physicians, but the trust is low with most investors.
Mm, mm. You've been really good about sort of investing in future leaders. So if I sort of give you a platform, waving my magic wand here and give you a platform to speak to 1 million medical students, if you could only say one sentence, what what would it be?
You've already proven to yourself that you can do a really, really hard thing while taking care of people. That can be amplified in any way in any industry.
Mm, that's powerful. That's powerful. I get the sense that do you view yourself as an underdog? Am I misreading that?
100%,
Okay.
100%. I wrote a book
Because
called Physician Underdog. I have a newsletter called Underdogs Don't Stop. I am an underdog. Um, and I think all of us are in many situations.
yeah, I want to unpack that for just a minute. I mean, every great builder that I've ever experienced and known has some form of a chip on their shoulder. What's yours, and how has it evolved?
Good people with good hearts should reach great places, and I don't see that enough. I just
Mm,
don't. Um, and I'm fighting. I believe I'm one of many. I'm fighting for myself, and I'm fighting to build a channel for those good people. I have kids and two daughters and plenty of nieces and nephews, and like we need really good people to reach these great stages. They are influential. They are employers of our future children. They are creators of opportunities. They're creators of more positive influence. It's so important for me. So I'm fighting for myself and others to get to those large influential stages.
that's amazing. I kind of want to wrap on this. I mean, you've done the white coat, you've done the pitch decks, you've done keynotes, you've been on stage. That's a lot. What part of your life's work still feels unfinished?
Ooh, what I want to do is continue to have conversations on large stages. That's what I want to spend more time doing. I want to spend more time doing this with a large distribution and be able to be inclusive with younger folks who have these questions and want some wisdom. I want to be one person to continue having these comfortable conversations. That's what I want to spend more time on. So
Right.
media content based on real things and
Mm.
and always bring the kind of vulnerable and setbacks up front.
This has been a pretty remarkable conversation, and you've shown that leading uh, the traditional path isn't isn't about escape. it's really about alignment. And I
Yes.
think with what you've built, with what you're building, um, it's not just venture backed, it's values backed.
Hmm.
And just want to say thank you for letting us go a little bit deeper today. And for those that have tuned in today that are listening, if you're trying to lead with purpose and scale and integrity, like this episode is your blueprint. And if there's a further topic that you want us to explore, or a leader that you want to hear from, drop me a note, leave a comment, let us know what you liked about it, and would you mind sharing it? So this platform is it's about community. It's not just about content. So thanks for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.
Thank you
See you
very
soon.
much. Thanks a lot, man. I appreciate it. I have to jump on another call if that's cool, and then we'll catch up
Cool.
soon. Thanks, man. You